Dr. David Nicholl, let's bring you in here. A senior doctor says 500 people a week are dying because of delays. Do you think that number sounds plausible?
I think it's entirely plausible. And just for reasons of time, I agree with everything that Stephen said. And if you look at social care, I mean, I was looking back, the DILNOT report on social care came out in 2011, and this has been kicked in the long grass again and again and again. And I have to say, also, that figure is also accurate. You know, my reflections yesterday, I was on call yesterday. I was on call for stroke. Okay, so normally as a stroke physician, I would never normally have to come down to emergency departments because such patients would normally be admitted to a medical ward, and yet I had to go down to emergency departments, and I saw an awful lot of people in corridors. This at a time, as has just been alluded to, when we've got a lot of COVID and flu. That's not a safe environment. So, you know, people are being treated in conditions which are far from ideal. And we have to look after staff, and have failed to do that. And, you know, in fact, the standard answer that the government comes up with is we're investing more money than ever into the NHS, we're recruiting more doctors. But if those doctors and nurses, indeed, are leaving out the back door through burnout or early retirements and things like that, we are failing to deliver a care service, an NHS and care service, which is appropriate for the country.
David, this pressure on your day-to-day work, how much do you blame that on the messages that went out over 18 months, 2 years during COVID from both the government and opposition politicians to stay away and protect the NHS?
I think that's too simplistic an answer. We did face a global pandemic, okay? But what I do find really annoying is people saying the current problems are that's just because of the stress of the pandemic. The reality is we went into the pandemic poorly prepared, and, you know, with less medical staff per head of population than many other comparable European countries. And, you know, we can't keep on with this. And the reality is, you know, the New Year and Christmas happen every year. We have failed to prepare, failed to invest in health and social care. And I'm afraid the chickens are coming home to roost. And my fear is actually that things will actually be worse, particularly in the next couple of weeks. I've been a consultant 20 years. I've never seen things as stretched as they were yesterday on a New Year's Day compared to other New Year's days. And that's a failure of really what the last 12 years have been.
I've just got to ask you about strikes before we let you both go. It's obviously the pressures on the NHS are not being helped by strikes of nurses and ambulance workers, more of which we're going to be seeing in January. Do you think that those groups need to settle as soon as they can on a lower figure than what they're after?
Well, I think the government needs to negotiate, and it has failed to do that. And you mentioned about strikes, but actually I was on call on both the strike day and a non-stroke day, and the delays in ambulances were actually worse than the non-stroke day.